Welcome to our weekly updates from Lil-Babybump, a mom and baby health center in BTM layout, Bangalore. Here our eminent doctors give you tips on topical issues every week.
Hi friends, welcome back again. One more with Dr. Adarsh.
Hi, good evening.
Good evening, good evening. And we are here to talk about infant mortality. And we have a shocking statistic in India that India is 10 times more. We lose 10 times more babies to infant mortality than the first world does. So, doctor, do you want to talk a little bit more about what this is, why it's so important to fight?
Yes, there are multiple things which go with it. Basically, infant mortality is defined as number of deaths which occur in the first year of life for every 1,000 live-born children. In UK and America, it is around 5 per every 1,000 live births, whereas in India, it is around 50 for every 1,000 live births. So yes, we are very poorly rated as far as this indices is concerned. WHO is putting a serious pressure on our government to improve this. See, in the Western countries, the care delivered to both the urban population and rural population, or to the rich population, middle class and the poor population, is almost similar. The differences are very minimal or very non-existent. Compared to India, there are government players, there are private players. So urban population has a different indices compared to the rural population.
And it's also different state-wise, isn't it?
State-wise it is different. Richer people versus poorer people, again the statistics is very different. Richer people, perhaps richer people living in urban metro cities, their mortality is very near developed countries, whereas the rural maybe shockingly discrepancy may be there. So I think this must be the focus of our urgent medical need for the next decade or so. We need to fight together, and when I say fight, it is not one person. Neonatologists have to be there, pediatricians have to be there, co-workers have to be there, government has to be there. All of us have to come down, put together, maybe some NGO organizations as well. Awareness has to be spread, and then it has to be a collective effort, Rajiv. I don't think it is an individual thing. And what else I've seen, and the neonatology care as a whole is definitely improving now. I see that when I came back from India, UK, and I see now some of the hospitals here are extremely good. 700-gram babies and 800-gram babies are now being saved in India.
And those are obviously very precarious babies, right?
Oh, absolutely. 10 years back, we were not there. So definitely the technology is definitely improving, although a lot needs to be done when you take up India as a whole.
I see. So that's obviously a fight that we have to really put a lot of effort in and make sure that we are able to improve that index as a nation. Thanks a ton, doctor. Appreciate the insights.
Pleasure.
You are listening to our weekly videocast from Lil-Babybump, a mom and baby center in BTM layout, 2nd stage, Bangalore. To find out more, please visit lil-babybump.com or facebook.com/lilbabybump. Thank you very much for listening.